Hey everybody, Dr. Bryton here for Two Tip Tuesday. Today we're going to be talking about something that is near and dear to my heart, and that is heart health. And we're going to be talking about how your oral health affects your heart health. So for those of you that maybe have high blood pressure, for those of you that have had a stroke or a heart attack, or maybe are at high risk for high blood pressure, heart attack, or stroke, this is something that I want to approach and talk about with you. Maybe you've been working on your diet, maybe you've been exercising to lower the risk of some of those cardiovascular diseases. Maybe you should be looking at your oral health as well. So I want to get into real quick how your mouth affects your heart. There are particular bacteria in your mouth that are associated with periodontal disease or gingivitis, gum disease, that are considered what are called chronic inflammatory disorders or associated with chronic inflammatory disorders. And what they do in particular is they start in your mouth, but they also work towards your heart, and they have two big impacts on your heart. One, they can increase the odds or the risk of developing the plaque that's in your arteries, and then they also actually dislodge those pieces of plaque in your arteries, and in doing so, those things build up plaque in the arteries as well as dislodgement in the arteries are associated with an increased risk for hypertension or high blood pressure, an increased risk of stroke, and an increased risk of heart attack. So what can we do? Well, for those of you that have tuned in before, those inflammatory causing bacteria, in particular, one of the big ones is P. gingivalis. And so if we stay ahead of that bacteria, if we debride that bacteria out, if we clean it out of your mouth, we can lower the risk of having some of those heart conditions, heart attack, stroke, high blood pressure, by purely keeping our mouth a little bit healthier. So that bacteria, if we get in there and we clean it out every 3 months, we can lower its exposure risk to your heart. And so we can, if we keep the mouth good and healthy, get in there, clean things out once every 3 months, keep that bacteria from producing its harmful effects to your heart, and clean it out again every 3 months, we can in turn lower your risk for high blood pressure, stroke, and heart attack. And I say those slowly because I want you to hear that. So for those of you that are on medications for high blood pressure, or again have had a heart attack or stroke, or high risk for heart attack or stroke or high blood pressure, this is really big news for you, because again, things like your nutrition, your exercise, those are awesome. You want to work on those, but take care of your mouth as well, because that can be a big influencer. So hopefully that's helpful for you. If you have any questions, please give us a phone call, comment on here if you have any questions. We love to answer those in front of kind of everybody that's tuning in, so that they can see some of those Q&As back and forth, and hopefully it can help them out. But if you can, like this, like our page if you want to make sure that you're not missing out on these at Mansfield Family Dentistry, or give us a call. We can add you to the emails that we send out. But thanks so much for tuning in. Hopefully that's again helpful for those that are tuning in, and we appreciate you. Have a great rest of your week. Thank you.